Okay, welcome everybody. We're going to start the meeting for the Board of Health. We have a quorum. Bobby, do you want to give the rules?
All right, and so today, December 8th, our Board of Health meeting is meeting in person, and we have access for the public via Zoom or on site. Our location is at 18 Mulberry Street. The meeting ID for Zoom is 89978-9686, and the 27198. And if anyone is having problems with it, you can call 603-821-2049. The meeting, you can also join telephone by calling 1-646-876-9923. And this meeting is being recorded.
Thank you. I'm Tony Soros. I'll be chairing the meeting. We have Dr. Petta and Dr. Stephanie Rosenblum here. We have a quorum. I'd like to move to have somebody move the November meeting minutes last month. Sure. Thank you. Second?
Yes.
Thank you. Those in favor? Oh, actually, first discussion is in the.
No, they look good.
Good, thank
Really
you.
good.
Thank you, very good. To the vote, and it's unanimous. The next is going to be discussion on reinstating the mask mandates for the city of Nashville. Bobby, would you like to give the groundwork on what the statistics are and what the trends are, et cetera?
Yes, so we've been watching very closely, as you know, ongoingly, the numbers for not just the state of New Hampshire, but also across the country. And we've seen an increase in cases over time. And in our state, we've seen a steady increase in cases as well. New Hampshire right now is sitting at the #1 spot in the country for new cases per capita, as well as our hospitalization rate is very, very high at this time, which is also very, very concerning. And so as of today, and looking at the state's website, and all of this information can be found on the DHHS COVID dashboard for folks to take a look at, and you can actually look at the trending, and there's also boxes that you can click on, shows the schools, the testing, vaccination, and all that information, so it's very important to have that. Right now, we're sitting at 170,080 total cases. We have 9,324 active cases in our state, which is high. Our vaccination rate for those that are fully vaccinated is at 55.2% and 61.3% for those that have had at least one dose. Our test positivity rate, which is another metric that we look at, we like to see that under 5, is at 12.3%, and that has been trending that way over a period of time. Our average daily cases is at 10,462. We currently have 441 individuals across the state in the hospital, and that's alarming because that has gone up significantly since when my report was actually put together on Friday. And we have had a total of 1,757 total deaths. There's 792 cases on average. We have 1,223 cases per day, and that's over a 7-day period. And this has been, our test positivity rate is also, this increase, is up from 28% for the past 7-day period. So when we looked at this the other day, it was 3%, that was a 3% increase over what was reported prior. And then now we're seeing a 28% increase as well. For the city of Nashua, right now, we are at 1,034 per 100,000 cases. That's that number to be at. Okay, can you please mute Mr. Owens? Mr. Owens, can you please mute yourself? Thank you. Our 7-day test positivity rate in Nashville is at 15.1%.
Bowen. Second for Bowen.
You please, you caller, thank you. We have in Nashville, 927 new cases in the past 14 days. Our total active cases is up to 590. We've had 12,227 cases since this pandemic began, and we've seen a total of 221 individuals that have a national address hospitalized, and our deaths are up to 108. So we've seen an increase in the number of deaths as well. When we look at the numbers of individuals as far as the positivity rate or the number of cases, those under the age of 20 is now turning at 22%. Those between the ages of 30 and 50, the number of cases is at 46%. Those between 51 and 70 years of age is at 23.9%, and those 70 and above at 8.1%. So the majority of our cases that we're seeing right now are in those under the age of 50. And as a result of that, internally, our team meets on a weekly basis. Again, we're watching these numbers. We're looking at the hospitalization rate. We meet with our hospitals on a joint call every other week that we're gonna now probably end up bumping up to every week, because we need to stay on top of the situation. They give us a situation update so that we can understand what's happening in the hospitals and with our long-term care facilities. And our hospitals have been hit really hard with this. The majority of the cases when they do come in, because individuals have to go on, some of them have had to go on the IC, on the ventilators. We don't have that many ventilators at each of our hospitals, which then puts the hospitals in these predicaments or situations where they have to make choices about who's gonna be on, the ventilators when needed. And then it also sets us up so that other folks that need to have other procedures or need to be in the hospitals, if there's an accident or some other emergency event, a stroke or heart attack, then you've got the competing of beds or the lack of beds for some of these individuals. We've also heard from our hospital partners that they now started to even have to send people out of state because we don't have the capacity in state. And so because of these things, we've had mitigation measures that we have seen work. There is a nice map on the state's website where you can actually see where the trending occurs over from the beginning of this pandemic till now, where you can see where the curve has gone down and the curve goes back up and goes down. And when the curve was going down is when we had certain measures in place, like the mask mandate that was statewide as well as in Nashville. We saw the numbers went down. We saw the numbers go down when the vaccinations started to roll out. And then we've seen where the cases start spiking up when we start relaxing some of those things. When businesses and restaurants open back up again, when the mask mandate was ceased, you start to see some of those things spike up. So because we're in this place where we are right now, we thought this was a very important time to have this conversation about reinstating the mask mandate, because we know that this cover does prevent the spread of droplets into an environment where we're seeing substantial spread. The Delta variant is what we're seeing mostly in the cases that we're seeing. We're also seeing individuals that are having breakthrough cases because vaccine is now waning and the variant is 99% of what we're seeing. It's important for us to again, look at how we can stop this. The hospitalization rate, as I mentioned, the age group has decreased as well. And so this is a really important time for us to look at putting something else in place that will help stop and slow down the spread of this infection in our community.
Yeah, I have two questions. One, at the partners meeting, which I just apologize. How is personnel at the hospitals? Are we?
Staffing capacity at all the hospitals across the state is down. Not good.
Not good. Okay.
Down for nurses, it's down for support staff, it's down in some places even for some of the clinicians as well.
You know, we lost a lot of healthcare workers in the pandemic that died or got COVID and have long-term symptoms and are unable to work. And there are also, you know, a lot of women in healthcare who are now home with their families because their families have illnesses or because schools are in and out. So it's a problem
Okay.
throughout the country, but here too.
So our capacity has been hit as well.
Yes.
The second question is, in light of Massachusetts and New York, removing elective surgeries from the menu list to go to hospitals, always national.
So I know that there have been some decisions made about decrease in elective surgeries because the capacity is just not there.
Yes, that's an absolute, that the hospitals are canceling surgeries where people would need to be hospitalized.
Mhm.
Because to your point, since so many beds are taken up by COVID, if somebody has an acute emergency having nothing to do with COVID, they're waiting in the emergency room for, many, many hours and sometimes, and that's not good for their care. As to my knowledge, as of now, they haven't yet canceled things like colonoscopies and things. But that did happen last year because of staffing and because needing to use the beds in the recovery areas as actually, secondary ICUs. Hospitals are standing up different units that are not accustomed to being ICUs, but they need, to expand the number of ICUs.
Chuck, do you have any questions?
No,
Or comments?
Just the scary statistic, Bobby, you mentioned about the younger population getting hit, and I would concur completely, because making phone calls every day, whereas the providers are asked to call for families about positive COVID results, negatives, we just let the nursing support staff do it, but I make at least 3 or 4 a day, which, 6 months ago I wasn't doing any. And we're not talking, the 18, 19-year-olds, we're talking the 6-month, I had a 6-month-old this morning, so babies to grandmas are getting it. And so we're in the trenches with this mess. And,
And if I may add also, Dr. Sturz, and so like the 6-month-old or those under 5, those individuals who cannot be vaccinated, right? And so the protection that they have is from the rest of us getting vaccinated and getting our boosters, and then also wearing the masks, right? And so all of the measures that we can put in place to reduce an individual's exposure to this virus is what we need to be doing right now. Especially when we see the deaths, are going up as well. In my report here prior to update for today, with the deaths that we had here, it looks like there were 140 more deaths than what was reported, in our last report. And I know today there were at least 6 more deaths that were reported. So, this is something that is preventable, right? And so you have that, there's the map there that goes up and down.
In the room,
Yeah.
Graphics paint a very good picture of what's going on and where we were hit in. The peaks, the top was when the graph shows average number per day in New Hampshire, and we all like to be number 1. We like to think the Granite State, having lived in New Hampshire all my life.
I know.
This is not something I'm proud of.
I think you forgot to mention about natural immunity and ivermectin in COVID death prevention. As Dr. Zelenko has done a lot of studies about ivermectin can be very valuable for COVID patients and also natural immunity.
So we'll have public comment after the board finishes. So Mr. Piatti, we'll get back to you, okay?
Okay, thank you.
You're welcome.
Yes. So I don't know how much they did hear because I don't know how long we've been muted. We've been muted, so I don't know how long that was.
Okay. Go ahead, Chuck.
Well, I was just going to finish that when we had back last December, we were up to 14 deaths per day. Then we came down because of maybe the summer, maybe we're outside again, but here we are again. The curve is going back up. So this is this was last week's phone call, partner call, 6 per day. So 6 people per day are dying of something that we can prevent through actions that we can take to protect all of us. So it's just really scary. And this the other one I just happened to see new cases I'm just repeating what you said in graphic form. You don't have to be a math major to see, I'm a ski patroller. I don't like seeing mountain peaks like this. We're going back up the wrong direction. So
Can I just ask a question? What percentage of deaths are in vaccinated versus unvaccinated?
All right, once we get to the public comment, Mr. Piatti, we will respond to that. So once the board members finish their discussion, then we will take public comment.
So
I lost my train of thought, but go ahead.
one of the things that we haven't spoken about, and I do thank you, Bobby, and your team for giving us updated statistics, is the new variant, the Omicron, which is now has been identified in about half the states in the country and fully expected to be, in New Hampshire, not sure when, but it's already in Massachusetts. And what we know is that it spreads much, much more quickly. The other information that we have that we didn't have last year was the effects of long COVID. So we talk about infection and we talk about death, both of which no one particularly aspires to. But more importantly, when it comes to the long-term effects, about a third of people that get COVID, whether it's a mild case or not, have long-term effects that last 3-6 months or longer. And more than 200 different symptoms have been reported with long COVID, including most notably fatigue and pain and depression and sleep disorders, heart problems, respiratory problems, neurologic problems. So we need to think of it in terms of the long-term effects on us and our community.
Anything further?
No,
Okay.
thank you.
All right, Bobby, any more information?
Now, I just think that, as we, continue with this, we did realize that after the holidays, we were going to see, some sort of an increase. We just were not expecting this at all. We're at record-breaking numbers in New Hampshire right now, and we're just at the beginning of the holiday season.
And before Omicron.
Stephanie, Dr. Sutton, can you give your opinion about the cycling of these viral things? Like, will we go inside, increase, higher risk?
Yeah.
There's reason for that. There's statistics for that, and we know why shouldn't this virus do the same thing. And we've already seen it last year.
Oh, yeah, we know for sure that the things you can do are distance, ventilation, hand washing, masking, and vaccination. Those are all preventative measures. We do have some therapies, but that's for people who already have contracted COVID and who already would be in a position to spread it to others. So it's a particularly bad time for the Omicron variant to come. In the Southern Hemisphere, it's their summer and they're having huge spikes. So when you think about it's cold, we're all going indoors, that, we know flu and colds happen at this time of year, and we're about to have Christmas and New Year's. And so what we really worry about is what happens when we can't treat people. Because what happened last year in Italy, when we didn't know what the mitigation steps were, we didn't have the information we have now, they were not able to save many people because they ran out of oxygen, they ran out of ventilators, they ran out of staff, they ran out of hospital beds. We don't want to be at that place. So the question is, we see this tidal wave coming, and what are the things that we can do? And meant as a temporary measure, to get us, I would say, if we would consider, if today we consider a mask mandate, what we're talking about is we just need to be able to make sure that things don't get ahead of us, because they're already getting ahead of us to the point us being the first in the country. So Bobby, my concern now is I definitely want to hear from the public But we have probably about 75 people on screen. When you consider it on screen and in the room. And it also is important for us to know who will be speaking. And it's also important for people who are not looking at all the different pages and also not maybe calling in and not looking at the Zoom screen, that WMUR is on the line as well. So just so full disclosure, people understand that their remarks are being recorded not only on our internal records, but also in a public setting.
So Dr. Sturz, we could move into
Yeah.
public comment and have that limited to
3 minutes.
no more than 3 minutes. Because, for those that want to speak, to give them an opportunity to do so. We have folks that are in the room with us, so we could give them priority, and then we'll watch the hands on the,
Sit over there or just here?
oh, you're good.
Okay. Alicia Houston, Westwood Drive. I am speaking today about transparency. There has been an astounding lack of transparency from the Nashville Division of Public Health and Community Services, specifically from the director, Ms. Bobby Bagley. On November 22nd, in a right to know request, I asked the question, does Nashville, New Hampshire isolate the SARS-CoV-2 virus from all other viruses in testing? Ms. Bagley's response on December 2nd was Nashville Division of Public Health and Community Services does not isolate SARS-CoV-2. We do not have the lab capacity to do this type of work. Therefore, NDPHCS does not have any documentation that states we isolate, purify, or can prove the existence of SARS-CoV-2 virus. This is done at the state laboratory. When asked the clarifying question, based on your answer to question 1, for clarification, the city of Nashville does not have any way to prove the existence of SARS-CoV-2. Is that correct? Ms. Bagley's response received on Monday, December 6th was, the test lab results we received from the state laboratory or reference labs verifies whether or not SARS-CoV-2 is identified in the sample sent to the state laboratory. Although I appreciate the responses of Ms. Bagley, this information is a lie. In an email response to a right to know submitted for myself from Elizabeth Maynard at the New Hampshire Department of Health and Human Services, Ms. Maynard stated that the Department of Public Health Services in New Hampshire does not isolate the virus or culture grow SARS-CoV-2 virus in cell nature. This means that the test is only testing for the existence of viral RNA. This could include anything from the common cold to the Ebola virus. SARS-CoV-2 at no point in this pandemic has ever been isolated, nor can the state or the city of Nashville prove the existence of SARS-CoV-2. Returning back to transparency and the significance of it, especially in regards to public information being shared by the Nashville Division of Public Health.
You have 1 minute?
Okay. The information provided is not only inaccurate, but it is founded on information that simply doesn't exist. Ms. Bagley and the state of New Hampshire have both confirmed that SARS-CoV-2 is not being isolated from other viruses. The reason for the uptick in cases and the positivity rate is because it's cold and flu season. Happens every year. However, given that SARS-CoV-2 is not isolated, it means all of the test positivity includes the cold, flu, and any other viruses in a person's body. A mask mandate in the city of Nashville will cause catastrophic effects on local businesses, and not to mention on the residents of Nashville.
You have 30 seconds.
Lastly, it is not necessary as COVID-19 testing is inaccurate, so your numbers are simply being reported falsely. Ms. Bagley, why don't you take a moment to be transparent with the residents of Nashua about the false information and inflated numbers from the testing that does not isolate COVID-19? I am certain that the truth would prevent anyone from implementing any form of mandate in Nashua or throughout New Hampshire.
Thank you. That's your time. Thank you.
Also, just as a note of procedure, people should plan to leave their masks on when they speak. That's very important. This is a building where patients are being treated, vulnerable persons. And, as someone that wears a mask all day long, I appreciate that it's not always easy, but for the safety of everybody in this room and for the safety of the people that are in this building, we really appreciate it. I believe we are going to
We'll continue with the
continue
comments.
and then our comments.
She had her hand up.
Sorry.
That's okay, no problem.
So
And your name, please?
it's Allison Dyer, 9 Squire Drive. And so with regards to the proposed national mask mandates again, the CDC itself had carried out extensive analysis of the impact of mask mandates in the US, looking at counties with mask mandates and those without. The difference, which the CDC, which publicly supported mask mandates, so it has skin in the game, was between 0.5% and 1.8% over time, or 1.32% on average. This is from the CDC website, volume 70. Given the extent to which statistical analysis is subject to assumptions and adjustments, there is a strong inference that no difference whatsoever, as the CDC states, was about 1.32%. Note that the headline of this volume says masks are associated with a reduction in cases. But you have to read well down into the executive summary to find the actual number, which is again 1.32%. People who want to wear a mask do. Additionally, everyone, including ages 5 and up, now have the opportunity to get vaccinated if they so choose. We're 2 years into this, and vaccines are available to almost every age group and a multitude of treatments. The continued narrative that people are incapable of making their own choices without local, federal, or state government intervention has worn thin. Again, we are 2 years into this, and the entire pandemic polarized and politicized the majority of people in our city, the state, and the country. They are aware of what to do individually to deal with coronavirus. On November 28th, Dr. Fauci himself said what many of us have known all along: learn to live with COVID because we're not going to eradicate it. Masks were meant to be worn for short-term use and to protect from blood or saliva splashes in operating rooms. Every 2 hours, a new mask is
You have
recommended,
1 minute?
as well as alternating with a period of not wearing masks. It is normal sick time here in New Hampshire. It is time to stop the continued talk of mask mandates for healthy people. Many scientific studies all around wearing masks of healthy people do not help stop the spread of the virus. People without any symptoms tested and a positive PCR due to the presence of a non-viable piece of RNA rarely spread a virus. The most important magic rule, ancestral wisdom, is to stay home, rest, hydrate, wash experiencing COVID or flu-like symptoms.
You have 30 seconds?
Strengthening the immune system with healthy food and lifestyle will decrease the risk of infections and chronic diseases. I'm asking that you do not recommend another Nashville City mask mandate to the National Board of Aldermen and continue health, wellness, businesses, and daily lives.
Thank you. All right. We're just going to ask that people please mute unless you've been called on to speak. Thank you. Ms. Halter, please mute.
Hi, Gloria
Hi.
Ortolano, 41 Berkeley Street. Thanks for this opportunity to talk to you all. I know you don't have an easy job and you don't like sitting here having to discuss this. I am not in support of a mandate though. I really feel that people are gonna do what they're gonna do, and they are well informed now. And when you put a mandate down and we're in the holiday season, I'm not certain they're not gonna go and have holiday parties and do what they do. If you put a mandate down, I would really ask that you apply that to bars and restaurants now. I'd almost like to see you say, if you think this is a big problem, then close the bars and restaurants, because that's where it's not used, and it's holiday time. And if that's not gonna happen, and you're gonna put mandates for masks on us, I don't think it's gonna be effective. I don't think a mask is particularly effective. I really don't. I see plenty of people use it, and they're doing it now. And I think that's great. If that's your choice, I think that's terrific. But the numbers with children, children recover by and large. And now that we put kids back in school, we're seeing a lot more infection rate with school children, but they're there. And I will tell you, the last thing I want to see is schools closed again. I do not want to see it come to that at all, or go back to remote learning. I think that's a disaster on so many other levels. So, and I don't envy you, you're in that position to have to make that decision either. But, I just don't think the mandate's gonna work. And I think people are tired of it and they know what it is they're dealing with. And if they incur these risks, and I hate to see the hospitals, stretched, and there's reasons they are with staffing, but that's not necessarily a situation we're gonna control with a mask mandate. I really don't believe that. And the restaurants and bars really concern me.
Yeah, 1 minute.
So I think I'm gonna yield my time.
All
Thank you.
right, thank you.
Thank you.
All right. There's a hand, Mr., does that say Richardson?
Was there other top of the room that wanted to speak?
Oh, sorry, I'm sorry. We have one more person in the room. I'm sorry,
My apologies.
Daniel,
That's
we'll
okay.
get back to you.
Two.
I just wanted to go on the record that I'm against the mask mandate as well.
And your name
Give
is?
your name,
Oh,
please.
I'm sorry, Susan McDonald, 103 Ledgewood Hills Drive.
Thank you.
Great job, ladies. You said everything I was thinking. Said it very well. I do have a follow-up question. And why is it that we can't in the state of New Hampshire get ivermectin or hydrochloroquine?
So that's a part of your, so we'll respond to all of the comments afterwards.
Oh,
That way we can give people.
okay. That was all I had. I went to the pharmacy and you thought I was asking for poison. And it's been proven that these drugs work and I want to know why they're not available and we have to go on the internet and go to pharmacies out nationwide to get them, so.
Yeah, thank you. All right, I'm sorry. Anyone else inside before we go to the folks?
I kind of missed it.
Okay,
I'll just sit.
all right. I do think that's Rick Richardson's. Daniel, I saw your hand.
Yes, can you hear me?
Yes, we can.
Okay, yeah, my name's Daniel Richardson. I live at 70 Berkeley Street in Nashua. I'm just want to address the ordinances which were previously in effect because I think that's where you're going with this. Your Board of Health has had an outsized impact on the Board of Aldermen's authoritarian ordinances 2018 and 2029 by way of the RSA 47:12. These ordinances were poorly structured. I understand what your objective was, but the ordinances left a lot to be desired. You cited no authoritative source for qualifying a mandate. That's one issue. Another issue is they contained a mandated face coverings which were proven ineffective against the virus. Let me give you examples of what that particular ordinance said. Fabric mask, scarf, bandana. These are the words that were in the ordinance. The doctor that's there knows that those are completely ineffective. Another thing is, it groundlessly applied the mask mandate only to building complexes of greater than 2 units. Why? That's completely arbitrary. Another thing, they arbitrarily allowed a baseless face covering exception while dining in a restaurant. I've gone to restaurants before. We all played the game. We walk around in the restaurant with a mask on. We sit down, and then we all take the masks off and we eat. It's ridiculous. We're closer than ever sitting down together at the dinner. So that's completely arbitrary. They contain no, this is key, they contained no criteria for sunsetting the ordinance. There was no measure of success when you would say, okay, it's all over, we'll rescind it. The only thing it said, excuse me?
1 minute.
Okay. The only thing the ordinance says is until rescinded. Now that is truly authoritarian. We're in control until we say we're not in control anymore. That has got to be changed. You cannot have that in an ordinance. You need to have a goal specified, a measurement. So when these ordinances were rescinded, the decision was based on no criteria at all. It was just they're rescinded. There was nothing in the discussion about having achieved the goal. This is history. This is what happened. Only a recommendation from the CDC was identified. It's just a recommendation from the CDC. No measure of achieving the goal is ever established. Thank you. That's all I've got to say.
Thank you. All right, I have Mr. Brady and then Paula Johnson and then Mary Sullivan. Daniel, can you please lower your hand so that we can keep track of folks?
All right.
All right. Mr. Brady? Mr. Brady, we can't hear you.
Too many mute buttons. Sorry, I'm here. Brady Owens from 16 Danbury Road. I'm here to oppose the mask mandate. Many of what's already been said is a lot of the things I was going to say. However, one of the things I want to ask is why is this always a one-sided conversation? We never get presented any information as to why the other, why mask mandates don't work, something that keeps coming up and time again. No one ever explains, why is Florida not spiking? Why is the southern United States not spiking? Texas, Sweden, they don't have mask mandates. They're fine. And so, if you go to court, you have to present both sides of the argument, and you have to argue for and against your opinions when you're trying to get a judge to decide on this. This has become very evident in the last 3 weeks as we've seen federal courts stomp down mandates because no one can justify their position. So I want to point out that this is always seems to be a one-sided conversation. Why is nothing ever presented about the other side? The other thing is the people that want to wear masks, allow businesses that want to require masks, allow them to. Do not mandate it. And that's all I'm going to say. I'll leave it for somebody else. Leave time for others. Thanks.
Can you please lower your hand?
Yep,
Paula
got it.
Johnson?
Thank you. First of all, I can't disagree with everybody who spoke against the mask mandate. First of all, mandates versus law. Remember, mandates are not laws. Anything that goes against the Constitution of the United States and or laws on record do not supersede the law. So this isn't even legal to talk about a mandate. So in case anybody doesn't know, here's where I got the information. I've been looking this up continuously. We've got poor kids in school, and I'm going to fight on this all the time. I am a person on the board that cannot wear the mask because I have health issues. I've been asked several times to leave the board meetings because I can't wear a mask or I couldn't put a shield on. That's called discrimination under ADA, no reasonable accommodations. Now we're asking, these kids have acne all over their faces. Parents are writing to us. The kids are sick from the masks. Florida parents took the masks and sent them out to cloth masks, and they came back with a lot of bacteria. So if these kids get sick, whose responsibility is it? Not me on the board, because I'm the one who's been fighting against it. Ms. Bagley, in one of our meetings, I asked you, what is the difference between 3 feet and 6 feet for droplets with a cold, the flu, or COVID? And you told me nothing. Well, I rest my case. So I'm calculating the numbers here that you gave out today. So if we combine the new cases and the active cases together, that's 0.02. That isn't even over a percentage. Enough is enough. If people want to wear masks, let them wear masks. What right does government have to dictate to the people who pay the salaries of everybody who works for the city? You all are appointed, except Ms. Bagley. But you're appointed. You have no force and effect on this. You can just give us your opinion, but you know what? At this point in time, I don't care about your opinion anymore. You have ruined the lives of a lot of people with these masks. 2 years into this, and we can't even have a conclusion to this. And I do all my research and people don't like it. So a friend of mine said this to me about faith in quick tests leads to epidemic that wasn't. And that had to do with whooping cough in 2006. And guess what test it was? It was the PCR test. And the PCR test cannot distinguish between a cold, a flu, or the COVID. So we testing people comes back positive, we shut everything down. Enough is enough with this. And I'll tell you, I'm not even going to walk around with a letter anymore in my possession if this comes. Nobody has the right to know about my medical condition now or ever. And nobody has the right to know if anybody's been jabbed with these shots. That's our private information. So government needs to come out of our lives. Thank you.
Thank you, Ms. Johnson. Ms. Mary Sullivan? Miss Mary, you're on mute.
Oh, hi, here we go. I'm here to oppose the mask mandate. I agree with what everybody said. I don't want to take up a lot of time because a lot of people have said what I already said, but I just want to let you know I've got a timer on. I won't talk more than 3 minutes. I'm a nurse, and I'm telling you, people, you're hearing in the media that the people in the emergency rooms are all the unvaccinated. They're not all the unvaccinated. Most of them are vaccinated. The other thing is the emergency rooms are packed because there's no staff to take care of the patients because they've been either left October 1st and walked out because of the mandate of the vaccine, or they were terminated because of the mandate for the vaccine. So there's no one to take care of the patients on the floor, so they're being housed in the emergency room. Boarded is actually the word you use. So a lot of this that, you know, you're talking about all the admissions and how the hospitals are overwhelmed, it's because of staffing. The other thing is not just nursing, you've got housekeeping. You can't move a patient up to a floor unless the room has been cleaned. So I just want to add that into the mix of the mask mandate, that, you know, not to get so, you know, people are getting kind of freaked out with the amount of patients in the hospital, and really if you had more staff there, that would really help a lot. But thank you for your time.
Thank you, Miss Mary.
Oh, you're welcome.
I have Joe C. next, and then Catherine, and then Julie, and then Alex. Joe? That looks like is Priotti. Joe Priotti? Joe, you're on mute if you are talking.
Hi, I just wanted to ask the Board of Public Health. This has already kind of been alluded to, but why not take a look at data from Sweden and Florida and look at like why these mandates aren't really working? I mean, for most cloth masks, I mean the virus is 0.12 micron, and cloth masks, it's a lot greater than that. It's kind of like expecting a chain link fence to prevent mosquitoes from going in. It's just really nonsensical, and masks are typically not seal tight. And if they were seal tight, you wouldn't be able to breathe. The other part is it greatly reduces oxygen content, available oxygen content, which is why some people may have medical issues with wearing a mask. It's a job hazard. If you're on a job and you say you're a miner, and there's low oxygen, I mean that's a huge health hazard. We're exposing us to that all the time. It's really just nonsensical, and it actually harms your immune system. All the recommendations by public health boards so far, including the lockdowns, the masking, social isolation, those are all things that weaken your immune system. And I think the reason why Florida is not having COVID spikes right now is because they are not isolating people in lockdowns. People can breathe freely without a mask. And and socialization is really important too. And I think we need to follow that. Those are the best data points we have right now. All the states and countries locking people down and masking people and vaccinating people. There's a clear correlation, higher COVID spikes. I mean, look at Israel. They're the most triple vaccinated country in the world, and COVID is out of control there. I mean, there's so many examples. I got to look at the true data here.
Okay, thank you. Ms. Catherine?
Hi there.
Hi.
Loud and clear?
Oh, yes, sorry, Mr. Paul.
No, that's okay. I'm actually on my girlfriend's computer, so I wanted to speak from here. My name is Paul. My girlfriend and I currently live in Brooklyn, New York, and we decided to jump on the Zoom because we've been discussing moving to Southern New Hampshire for the last few months. She's already quit her job. I am a work-at-home freelancer because I cannot work because I am not injected. Listening to everyone on this Zoom so far, I agree with many of you folks who are opposing the mandate. We currently excuse me, I lost my thought because I put my camera on. We were interested in the state because coming from New York City, the mandates are ridiculous here, not being able to go indoors without masks, not being able to visit museums or movies or any of these locations have been really downplaying on our life. And we decided to move to New Hampshire because my girlfriend is from there. And recently her grandmother just got sick, who lives in Hampton. And within 2 days, she took ivermectin and was back on her feet, and she's 85 years old. So that kind of also, I just wanted to throw that a small tidbit out to the other folks who've already brought up ivermectin. Another thing I just wanted to mention is that I am a filmmaker, and I'm currently working on a documentary called Planet Lockdown Film. If no one's heard of it, you can Google that. The documentary will be coming out in a few weeks, and I've been working relentlessly on it with the director, cutting down about hours and hours worth of footage from people around the world, all these doctors, all these scientists, all these lawyers, talking about what is wrong with this whole big picture and how essentially lockdowns have been harmful to us as a humanity and to civilization, the economy, et cetera, et cetera. So again, we were interested in moving to New Hampshire, and we saw this, and this was vital to us to be a part of this and to just speak our opinion, and hopefully, yeah, so thank you for listening.
Thank you, Paul. Miss Julie? Miss Julie Smith? Miss
Sorry, I
Julie,
didn't unmute. No, I wasn't raising my hand, but I'd like to give my time to someone else. Maybe Therese?
All right, thank you, Miss Julie. Alex?
Hi, good afternoon. I just want to start off by saying I heard that WMUR is on the line. I just want to say they cannot be trusted because they've essentially been advertising for pharmaceutical companies from the start of this pandemic, quote unquote. That's my first comment. Next, on to masks. First of all, if you're going to make people wear masks, you need to prove that this environment that we're in is hazardous and that there's actually some particle in the air that's a threat to my life. Nobody's proven that to me or to anyone. Then once you can prove that, you can't just put on a cloth mask and say that that's going to protect people. That paper mask that you have does nothing for viruses and illnesses and flu, okay? If you want a real mask, right, you need to fit test people properly. You need to make sure there's a proper seal around the mask. You need to make sure that the person has a medical evaluation so we can know if, you know, they're fit to wear a mask. Not everyone can just put a mask on and be able to breathe properly and be healthy. Bottom line is wearing masks long-term and continually is not good for health. It's not a good thing. And you guys have no authority to do this whatsoever. I know you think you do and you enjoy this type of power, but you have no authority to do this. And my last comment is, I saw the gentleman at the end of the table pull his mask down to take a drink. I just want to know, would you guys do that in asbestos abatement, right, in a hazardous environment? Would you pull your masks down to take a drink? So I'm very much against mandates. You have no authority to do this. I yield my time.
Thank you, Miss Alex. It looks like, Sharon, Miss Sharon? Giglio?
Yes, that's me. Thank you. I'm speaking as a citizen. I also am a member of the Board of Education, and I have some things to say that may differ greatly from what we've already heard today. First of all, people who are dead from COVID, hundreds of thousands of them, have no rights. They are not allowed to speak, but we need to speak for them. Our state is now the highest in the nation for the spread of COVID. We have a pretty low vaccination rate that has not climbed much over the past 6 months. We need to do something so that we can protect everyone. And mask wearing is one of the choices we have, and vaccination is certainly an even more important choice. We cannot mandate that people get vaccinations, but apparently we can mandate masks. We did it before in the spring and it was effective. In addition to which, there are loved ones in my family who are undergoing medical tests and evaluations for serious illnesses who may not be seen if we have to go to the point where those tests are no longer allowed. I also believe that that the predominant variant right now, the Delta variant, is still really troublesome, and that we have trusted people to do the best thing for the rest of the public, and they are not doing that. A recent study noted that 25% of American adults are afraid of vaccinations, or needles in particular, and that many of them are now refusing the vaccine but clouding their reasons with political statements that have nothing to do with their real fear of actually being injected. I know that what I'm saying may not be popular with a lot of people, but I think we all need to take care of ourselves and our neighbors and the public, and we are not doing that. We need to consider masking again. We have never been in worse shape than we are today. Thank you.
Thank you, Ms. Trigu. Okay, I don't see any more hands, Dr. Sturz, so we're done with the public comment.
Thank you, public. I appreciate your input. The board will try to answer some questions that were presented.
Excuse me, can I speak?
Yes, sir.
I had my hand up. I'm sorry. I don't sorry.
Oh, Mr. Crowley, you've already had 3 minutes.
That looks like a different.
Oh, that's a different one? Oh, it's
No.
a different. Patriotic.
Yeah, sorry.
Apology.
Oh, it's a different one. It's a different name.
It is.
I'm
Sorry
sorry.
about that.
No, it's not your fault.
Yeah, there's a lot of Italians around, I guess. Can everybody hear me?
Yes, sir.
Okay. I am on here just to not in favor of the masks. I don't plan on ever wearing another mask anywhere I go. I've had COVID. It wasn't much of a big deal for me or my family because I'm in the age range that is not at risk. So I just want to share some numbers because we keep talking about cases, but I'm going to talk about what really matters, and that's deaths. Now, our overall death rate early October was survival rate, I should say, 98.82%. That was all ages. As of December 6th, it went up to 98.95%. 0 to 19, we have 100% survival rate. 0 deaths. 0 to 29, it is 99.997% survival rate. 0 to 39 is 99.983% survival rate. 0 to 49 is 99.959% survival rate. 0 to 59, 99.915% survival rate. And 0 to 69, 99.795% survival rate. So as you can see, the deaths are pretty much in the over 70, mostly in the over 80 age range, with I believe about 50-some% in long-term care facilities, which those people don't even go out. So those people won't even be affected. Those people wouldn't have been affected by a mask mandate because they didn't go out. They were in long-term care. So I just wanted to leave you with those numbers. I don't consider 99+%, almost 100% survival rate as being anything we should overreact to. For anyone under 70, you're looking at 99.795% survival rate, which is, it is very good survival rate for a virus, and it keeps going up with time. It was much higher last year. So if mask mandates were justified, it would have been last year. This year, obviously, with the death rate going way down every week, it doesn't seem to be justified at this time. So I yield my time at this moment. Thank you for the time to speak.
All right, thank you. And I do see one more hand. It looks like Keith. Is that Keith?
Yes, it is. Can you hear me?
Yes, sir.
Okay. There's one other point that I haven't heard raised, and that is, and I watch and listen to Doctors Fauci and Walensky, and given who's attending this meeting, this stuff might not be real popular. But a big part of wearing masks
is not, as a couple of individuals have stated, to protect yourselves. It's to protect others. I've got young kids in my orbit who are too young to be vaccinated, and the idea is masking up, is geared towards protecting them because they're like the most vulnerable. And I just think that's a point that hasn't been struck before. So thank you.
Thank you,
Thank you.
Mr. Key. All right, we have Katie Hatcher. Katie, you're on mute. If you want to take yourself off mute, please.
Hi, yes, my name is Katie Hatcher, and I am a public health nurse with Nashville Health Department, but I'm not here to speak as a nurse. I'm here to speak as a mother of an immunocompromised 7-year-old child. I'm going to keep this brief. I just want to say that the integrity of a community can be measured by how well we protect our most vulnerable members, and I just would like to remind people of that. Thank you very much.
Thank you, Ms. Hatcher.
Thanks, Kate.
Okay, Dr. Sturz, I don't see any more hands for comments.
Okay, again, thank you, public, appreciate it. Hope you feel that everyone's had the opportunity to speak. I'm sure that some of the board members would like to address some key questions or comments that were made. So I am going to start with Stephanie. Dr. Stephanie.
Thank you very much, Dr. Stewart.
Sorry.
So first of all, I would like to thank everyone for coming and for sharing their opinions. This is very important dialogue. And the Board of Health does not discuss these things in advance. We didn't come to this meeting with a specific proposal or with a specific opinion. I have not discussed this with my colleague because this is the process in Nashville, New Hampshire, where all of the discussions occur in a public forum. So I wanted to make sure that was clear. Also, the Board of Health makes recommendations. So as far as the aspects of the laws and the rules and what's in it and how it's framed and how it's enforced, whatever rules do come into play, that's really in the wheelhouse of the Board of Aldermen. I will do my best to talk about masks in the run-up to us having a discussion about whether now is a time to recommend to the Board of Aldermen that we reinstate the masks. There's a lot of different threads about COVID that are brought into them. Somebody was talking about lockdowns. We are not here to talk about lockdowns. We're only here to talk about masking. I'll try to address some of the other facts that came in as, what are the alternatives to masking? So somebody said that this has been very divisive, and we all agree. Sadly, it has been very divisive. And I'm not surprised to hear that there's so much opposition to a mask mandate. As a Nashville resident, I hear it from people in many different spheres. But I'm not here to give my opinion. I'm a physician and I'm a scientist. And what our role is to analyze available information and to share informed recommendations. I completely agree. And I'm quite sure that my colleagues in this room, Director Bagley, and the other thoughtful people, hardworking people on the Board of Health, would agree that people can make excellent decisions. But to make a good decision, you need good information. The concern we all have in today's environment is that there's so much competing information. It can't all be right. And this is a very unique situation, this COVID. Why? Because information is being published before it's been gone through multiple layers of validation. especially in the beginning of the pandemic, it was hard to know. That's something that was never unique to, not completely unique to COVID insofar as there have always been competing, opinions about how to treat different things. But what I would say is that there is a lot of information that was stated today that as a physician and scientist, I would not agree with. And I've studied this day and night since March of 2020. Make no mistake, COVID is real. 790,000 people in the United States are dead because of COVID. Not the flu, not the cold. And I know there's a lot of talk earlier about people brought information about testing and not testing. This is around the world. This is throughout the United States. These are thoughtful scientists that have devoted their lives to these things. And deaths are not going down. Originally, somebody mentioned deaths were in older persons. That's exactly correct. The most vulnerable. However, the vaccination rates in older persons are higher than in younger persons. And what I can tell you is I recently read that in Texas, somebody mentioned Texas, in the September-October timeframe, the death rate in unvaccinated people in their 40s was over 50 times that of vaccinated person. Vaccines are not 100%. Masks, are not the answer. I want to talk about that. Some people also mentioned spikes. And mentioned that certain parts of the country are not having COVID as spikes at the moment, and that's true. But what we know from studying respiratory illnesses for years is that they go in rolling waves over the country. The entire United States does not get sick at the same time. And you might have seen me writing because I wanted to make sure I address as many things as possible. But I don't know that you can necessarily see this. No, that's not the one. I tried to pull up some.
Can you share your screen?
I might be able to.
Yeah, you're in the meeting, so if you can share your screen, that would be, yeah.
I did that because I wanted to be able to see people.
Yeah,
Let me see if I can do it. Which one? Let's see. So this is from the state of Texas. I'm gonna get rid of this thing.
Just put this on the little,
There we go.
right?
Right. This is the case rate. And this is, I don't know if you can see the top of it, from Texas Health and Human Services. So there was a huge spike in the August-October timeframe. So they were more spiked then. Why? I don't know. Because it wasn't cold down there and all the stuff we talked about. But that is absolutely true that Texas isn't as bad as we are right now, but they were before. And they may be again now with the Omicron variant. Let me get back to my notes here.
So you can stop sharing.
Oh, stop sharing. Did I shut that? Okay, okay. Now so I can get to my notes. Okay. So, and this is, I know somebody mentioned about the hospital being stretched, and it's absolutely true that we've lost staff because of the mandates. But what we have right now is the concern not that the hospitals are stretched, but that people are going to die from treatable illnesses, curable illnesses that are not COVID related because of the spike. So, a couple of things. We're about to enter winter. When it comes to winter, there's stuff that we do. We wear layers of clothing. We wear shoes with treads. We, salt our sidewalks. There's not one thing that keeps us safe from being injured from the winter. You have to have layers of protection. another analogy I would like to bring to people is that when people get sick, the amount of exposure matters. So for example, let's say, I'm sorry, are you filming?
No, I was gonna take a couple photos.
Of,
There's a Dean to look at that.
oh, Dean, I recognize, you. I have on my reading glasses.
Sorry, I should have
Right.
identified
Yeah, you
myself.
can, make sure you get my COVID here and there, right?
Yeah.
I went on natural, okay. So,
A couple of us had to go on natural.
so, you know, when people get sick, it matters how much exposure they have. For example, if you're gonna get food poisoning, if there's a rotten sandwich and I take a bite, and then I said, no, this is not right, I'm not eating it. And my husband with a cast iron stomach says, seems fine to me, and eats the whole thing. The likelihood is he's gonna get very sick and I might not get sick. Well, COVID is like that in some ways, that the amount, or all respiratory illnesses, the amount of exposure. So the question is, what can you do to limit your exposure? One thing is distancing. Distancing is imperfect. And the reason that it is hard to have a significant difference between 3 and 6 feet, somebody mentioned that, assuming people are not yelling at each other, so that the little pieces, it doesn't sound very pleasant, but the little pieces of spit are not going back and forth. But the issue is that COVID is an aerosol. It's not in big particles, it hangs in the air, which is why I really appreciated people keeping their masks on, and the limit of the number of people, you know, in a space. The ventilation in a space makes a difference because it pulls the virus up. And people that are talking about masks being insufficient, maybe being a smaller part than we would hope, are correct in many things. Fitted masks are better. I'm wearing what's called an N95. And right now, because the supplies are good and different than they were a year ago, wearing an N95 or wearing a surgical mask and then a cloth mask over it so that it's held in tighter is better than wearing other things like a bandana but every bit helps. There have been studies that show it does not drop your oxygen level, it does not weaken the immune system, but it is a definite piece of the puzzle that reduces your risk. If somebody has just even left the room that had high viral loads of COVID, much more relevant now that we have Delta, and probably even more relevant when we have Omicron. And to the point that's been made, it protects others. We have a very celebrated history of taking care of each other as a community in so many ways. And this is an important way that we can take care of each other. People talked about some of the treatments they would like to see available. And I'm going to see if I can share another piece of my screen. Actually, I'll come back to me with that, Tony, because I want to pull up this one chart that talks about treatments. I am extremely concerned about having a mandate that is not going to be something that people are going to utilize. It's going to be more divisive.
Are you ready?
Or if we don't have a good way of making it stick, of making sure that people do what they're supposed to be doing and not making frontline workers the mask police. So I am very, very torn about what to do today because I hear what you're saying. I fear for our businesses. If our restaurant workers are not wearing masks and they lose all their staff and they have to shut down, that's happened last year. So we're not just thinking about, you know, individuals. We're thinking about the vulnerable people, the community, our businesses. And I look forward to discussing with my colleagues what our recommendation will be, because this is hard.
Chuck, I know you're on the timetable today. Is there anything that was said that you have want to enlighten the public?
I think,
Board?
Dr. Wolf-Rosenbaum echoed so many strong sentiments there. She highlighted them, and I support them wholeheartedly. I would start with, as the Board of Health member, that we're an advisory group, that we're not a dictatorship. We don't have egos. We don't have agendas. As stated in last year's debate on Zoom last year on the same topic, we're here just to hopefully throw recommendations to the aldermen, who truly will enact or not on our thoughts, what we think medically would keep our people safe. And that's the definition of public health, which is doing the best we can in tough situations to educate, advocate, inform, and help all of us decide, not as a autocratic, a word used I've heard a couple times today. It's a democratic process. So I love all these altering opinions, and thank you for coming. I'm sorry, my back side to you. This is my good side, I will say. When I like it. So, but as a pediatrician, I just go to the heart of the matter, and I think, again, COVID is real for kids. Kids die from COVID. So I heard a couple comments that kids are more resilient, their immune system can handle it. Well, the facts are, number one, they're not tiny adults. That's the first thing, but they can die, and they're unique in the situation of, for me, a mask, as I say every day, in a respectful way. The reason I'm wearing my mask today in my consultation with a shield, and often N95s also, is out of respect to you in this room, which is a lot smaller than this, I'm protecting my breathing mechanism apparatus from you, so that you're not going to be going down a hill, because I don't know what your immune system is. I don't know what your medical condition is most of the time, the adults I speak to. I do know your kids' conditions, and hopefully they'll survive. But the statistics that we're showing, the graphs that we're seeing, is you can duplicate that for the pediatric population to a T. And it may have taken a while to get there, maybe because of vaccines now more available for a year for adults, and maybe in a year from now we'll see the same for kids. We're getting protected, but they're going to follow the same pattern. And our pediatric units are overstaffed, understaffed, and overflowing with patients. Southern New Hampshire, I just heard today, is moving their PD floor to a different unit because they're trying to, make beds available. Yeah. Dartmouth, Hitchcock, and Lebanon is completely swamped with ICU kids. So Dr. Wolf Rosenblum is a critical specialist. She spent her career dealing with pulmonary, people who die in a ventilator. The dead don't speak, and ventilated patients don't talk. So we're here to protect those patients, those people, those loved ones we all care about. And it's very personal. And I love we all speak from our hearts, and I love the, conflicting and, opposing views here. I mean, that's what's made this process unique. But, I think we just have to be respectful of what we're trying to do, which is keep you healthy, and mass work, and they have a role. And I too am torn in the contents of, I have so many friends and relatives who live in the family businesses of restaurants, hotel industries, all these small businesses that aren't big mega institutions that can draw from funds elsewhere. So they're living day to day. So, I just want you to hear us, that we are respectful of that. We're not just sitting here willy-nilly throwing out decisions. So thank you again for coming today to listen to us. It was fun to see 70 people on board. That was great. Thank you.
Stephanie, anything you would like that?
Yeah, I wanted to share the screen.
Just a chart.
Okay.
The New York Times has been compiling for the entire pandemic a list of the most talked about drugs and treatments for COVID-19. They're following 33 treatments for effectiveness and safety. And somebody mentioned ivermectin. And right now, there's evidence in cells that it might kill viruses, but the doses, how come it's not sharing this one?
So you have to go out and come back.
Go out and come back in.
So stop sharing, yeah, and then share again, and then pick that screen. Stop sharing, and
Yeah.
then stop.
Okay, it's share again, see?
That one.
Yeah, so this is the one about ivermectin. So, you know, there are other treatments that are coming forward that have been shown to make a significant difference, but ivermectin, which is used in humans to treat river blindness and used by veterinarians, I understand. So just wanted to point out that this is being studied thoughtfully, but at the current time doesn't meet the standards for a treatment that would be recognized.
Thank you, Stephanie. You good?
Yeah.
Stephanie, other discussion?
No, I've often proposed to families who, say similar comments today that we've heard that maybe it isn't as big a deal. I said, well, I would love to have you walk in our shoes. Walk over to the hospitals. Until you have a loved one who's sick or dying in a hospital bed, and so many stories out there that said, oh, I wish I had had it. And some people have recovered. I've heard that today too. But in kids, it's going to be a big mess. The long-term COVID, I think that is a real entity that's coming our way, from mental health issues, behavioral health issues. Masks, you're not going to die of acne. I heard that comment today. You're not going to affect your social skills, with a mask problem here. So I'd like a live child versus a dead one. And so I'm going to be all in favor of wearing masks, and we're protecting the ones that aren't right now eligible for getting the vaccine by doing so.
Okay. Let's see, Stephanie, would you like to propose a legislation if we're not allowed to legislate, or form an ordinance with our recommendations before the Alderman?
So I'm going to be honest with you, Tony. I don't think we are prepared to, after all this discussion, to make a recommendation today to the Board of Aldermen. I just think that is too many questions and too many variables. If it was up to me, I would absolutely recommend a mask mandate. But I don't think the political will is there. And I think there's so much what I consider to be misinformation out there, much of which we've heard today from people that are here very thoughtfully and giving up their time because they really think that this is the wrong thing. And I think that it would be more meaningful for us to give the Board of Aldermen a range of options how to proceed. I think because public health, more than anything else in the history of mankind, has saved lives, public health measures are important. But if the political will for a mask mandate is not there, then we need to think out of the box and creatively. Do we, provide masks or recommend that all businesses have masks and, have a sign that say, we do require, as a business, we require masks. I think at a minimum, we would want the Board of Aldermen to endorse that businesses have the right and are encouraged even to have mask mandates, and that people should expect that they should not go to those institutions. At the last meeting or the meeting before, I talked about businesses having certain hours, especially, grocery stores and critical places where masks must be worn so that people who are vulnerable, people who believe in masks, people who understand that the vaccines work, but until people get their third shot, it may not stick. The people that understand those things and want to be protected, want that extra layer of protection, I think they should be able to function and feel safe in our own community. So I really hesitate to create, more division and also something that isn't enforceable. I don't know how you guys feel about that.
I would 100% agree. I don't think we've reached, I think we needed this background of information to kind of hear where the public's at, and what level of understanding, comprehension, or disagreement is happening. And I think if we're truly taking our role seriously, which we all do, is I think we respectfully say, thank you, and maybe we should opt to have an emergency meeting like we've opted for recently, to have another sit down to have this discussion. And I like the idea of giving choices there to different layers, have it stratified so you have some choices, and show the aldermen how well we really want to tackle this in lieu of what happened last year, because we don't want to divide the city. We don't want to divide, we're always going to disagree and agree, but if we don't have the political weight behind us, it's going nowhere.
Yeah, I don't know if people know that the Board of Health took it upon themselves to slot in an extra meeting every month over and above what we were asked to do when we were appointed, just in case we had important discussions that were timely. The other thing is, we may know a lot more about the Omicron variant, transmissibility, and how dangerous it is in another week. I mean, another month will be even more, but it may be a whole different ballgame by next week.
Okay, knowing that, two things. One will the next meeting, but the first one, the wording that I'm going to propose that goes to the Board of Aldermen is really just an iteration of what we talked about actually a couple of months ago. But specific to this, in light of the current COVID situation, the Board of Health highly recommend that people get vaccinated, wear masks, practice social distancing, and wash hands.
I would also add that full vaccination now is 3 shots. Or includes the booster, fully vaccinated according to CDC guidelines.
Did they change them? I'm sorry, did they change them? I haven't seen an update on that yet.
They're recommending boosters.
Everyone over 18, yes, should go ahead and get the booster because the vaccine.
But it's not mandated.
No.
No, we're not talking about that.
Can I just have one?
Yes, please.
So, I would, count this as director of public health, and, with our health department looking to work as hard as, we can to keep everyone safe and protected and getting information out. Our victory is not in getting a mask mandate for Nashville or the greater Nashville or New Hampshire. Our victory collectively is in doing the right thing to protect as many people as we can, those who can't get vaccinated, those whose vaccinations are waning, by doing these measures, right? And so the point of this discussion is not to win anything other than to help educate people based on the data that we're seeing. And it breaks my heart when we think of it's just older people, that are dying. That's someone's loved one. That could have been a wage earner that was supporting families, right? And so our victory really is in our community working together to do all that we can to stop the spread of this infection. These numbers are really, really high. They're not going to go down if we don't change our behavior. So it's not we won because we didn't get a mask mandate put in place. I hope that's not how we're thinking when we leave this space. I hope that our hearts and minds are in what can we as community do to protect the most vulnerable and ourselves, because some of us can end up with COVID. I don't want, I would hate for any of us to get COVID because we just don't know. It's like a Russian roulette type of wheel. Who's going to get really sick and end up in the hospital? Because we've seen young people in the hospital and we've seen younger people die. I even have a family member who ended up with multi-inflammatory syndrome, 13-year-old, my 14-year-old niece. Did that come out of the blue? It sure did. Is that scary? It sure is, because she could have died. So I'm glad that in our state, we have a 98% recovery rate. That is good. We don't know what the long-term effects of this are. We just don't. And no, people shouldn't be walking around like, oh, if we get COVID, I'm okay, I'm healthy. You don't know what's going to happen to your body down the line. If wearing a mask slows down the spread of this infection, protects others and ourselves from getting this virus in our body, do it. If social distancing does that, let's do that. If getting vaccinated and getting our boosters does it, let's work together to do all that we can to stop someone else from getting sick, ending up in the hospital, and possibly dying. That's where we have a victory. And I appreciate everyone that spoke. And I think, Laura, you said it, everybody knows what we're supposed to be doing. Let's just do that. Thank you, everyone, for sharing today.
Next meeting date.
Excuse me? Oh, sorry, I had raised my hand. Miss Bagley actually didn't address my public comment with her statement that we don't isolate COVID. So I wanted to get her response from that before you end the meeting.
I'll let you know.
All right, thanks, John.
Thanks, John.
Do you want to-
We have a lot of questions that people had asked, and to try to single out one right now to give an answer would not be doing justice to the other people who would stand up and say, hey, how about me? I had questions. So,
I don't believe Miss Bagley had answered any questions, did she?
and so did Dr. Chuck, and so did Dr. Stephanie.
Okay, so we're not going to address Miss Bagley's statement that we do not isolate COVID in Nashua.
Ms. Houston, this is Dr. Stephanie Wolf Rosenblum. I can see you're very passionate.
Well, I would like to correct you as well. There have been 0 children's deaths as of this morning from Elizabeth Maynard for children under 18. So I would like for you guys to provide the actual facts and the numbers statistically on the day of your meetings. And Ms. Bagley should absolutely answer the question about why we are not isolating COVID and how are the numbers accurate if you're not isolating them from other viruses.
So, may I?
Sure.
So one of the challenges of having a once a month Board of Health meeting and of the meeting being a public meeting is people have many, many questions, concerns, frustrations around what's happening. Unfortunately, we're not able to address all of them in a meeting like this. And we've devoted this meeting to talking about whether or not we should have masks. And so there was also talk about lockdowns, and I know you have a lot of questions about what the testing is. What I can tell you is there are many, many children in the United States that have died from documented, proven COVID. And we definitely would welcome an opportunity for people to weigh in to the topics on the agenda. But I'm so sorry that we're not able to address all the different aspects of concerns that people have. And so I'm sorry that you will walk away from today's meeting and not be satisfied with the response, but.
Well, I just feel like if you guys are going to make the recommendation for masks and that's the decision, then you really should be looking at the fact that Miss Bagley herself stated that we do not isolate COVID, so did the state of New Hampshire. That's an important fact.
We will take all facts into consideration when we make a recommendation for a mask mandate, which is not being made today.
Thank you.
Okay, thanks.
What do you want to do about the reports and stuff? Because the secondary meeting was supposed to be.
Right,
Yeah.
so it's gonna get shelved today.
Okay.
What date do you want for your second meeting? Next Wednesday? I don't know if Chuck can do that, but I will ask.
Well, I mean, I thought we slotted in the Wednesday thought. I don't know.
You don't have a lot of days.
No, but we slotted
We
in
did.
specific dates because he, you know, because of his clinic. Thank you, people.
Thank you.
Good to see you, Colin.
You too.
I think what we did was, that was starting for January officially.
I see.
You can correct me if I'm wrong, but basically what you have is the 15th, the 22nd, and the 29th. And I personally, not that I'm meeting guy, but I would probably try to stay away from the holidays.
Yeah, I would say.
So it really leaves you with the 15th if you're gonna do Wednesday. unless you want to pick another day.
Well, I think what we,
Dean, thank you for coming.
thank you, Dean,
My
that
pleasure.
we actually want to
We
make.
we went to high school together.
Yes, I
I'm
remember.
sorry, I didn't recognize you, Dean.
Oh.
I think my
Between the
vision is
mask
about up to here.
yeah, your glasses and everything.
Yeah.
So the date you're choosing now will be the date you'll meet to decide on whether to issue.
Well, probably
Well, not
discuss.
issue, we'll make recommendations. We want to give the Board of
Make the
Aldermen some
recommendation.
choices because we
Right.
recognize that a mask mandate is, a hot button issue.
Right.
And so we don't want it to be an all or nothing. I think that there are sort of degrees.
So what you decide, at this meeting you're gonna schedule now will be either what to recommend to the. board.
Correct, that's correct.
Okay, I just wanna make sure.
Yeah,
I
we
worded
only
it
make
right.
recommendations. We don't make law or enforce the law. We're just a recommendation.
Right, yeah, that's exactly, it, just like the committees do to the
Exactly.
full board of all. All right.
How's your sister Karen doing?
Doing great.
And Bill, how's Bill doing?
I'm great.
Good.
Everybody.
Our meeting's not over.
How's-
Oh, I know what- tell-
This is all on the record.
Yeah, our meeting's not over.
Just tell my-
This
tell
is
my
gonna
sister
be
that.
on WMUR
Well, that's okay.
tomorrow.
Are you
Yeah.
still practicing?
No, I'm retired.
Oh, you are?
So,
Okay.
Tell
one
him I
other
said
thing,
hi.
Oh, Bill, take
so when
care.
we talked about meeting dates, if I recall correctly, we meet on the off week from the Board of Aldermen. Do you want to end the meeting?
Yes, please.
Just missed it.
Okay. Thank you, everyone.
Okay, so I need a motion to end the meeting.
So
Seconded, in favor. Okay, thank you, audience. We are actually done. Just gonna pick a meeting date.